Hello, welcome to the Amakitio Duo's Play Pretty series, Episode 2, Embouchure Basics. My name is Diane Barger, and I am Professor of Clarinet at the University of Nebraska-Lincoln.
And I'm Denise Gainey, Clarinet Professor at the University of Alabama at Birmingham.
And together, we are the Amakitio Duo.
Today, we want to talk about the basics of clarinet embouchure and how to teach it. So in this video, we'll offer two similar approaches to teaching the basics of clarinet embouchure that you can use as a band director or in your private teaching studios. I'm going to talk about the band director approach. So here are the typical instructions for formation of embouchure from beginning band books. Fold your bottom lip slightly over your bottom teeth. Place the reed on your lower lip. The mouthpiece should be in your mouth about a ½ inch. Rest your top teeth on the mouthpiece. Close your mouth around the mouthpiece as if saying two. Take a full breath. Exhale through the mouthpiece and play a long, steady tone. This is just enough information to be dangerous, as clarinet embouchure is not a one-size-fits-all subject. There are just so many variables with mouthpiece facings, the student's lips, dental structure, and oral cavity. This is how I guide young students in the formation of embouchure. Have the students use the mouthpiece and barrel together for embouchure practice. The barrel and mouthpiece together should be able to produce a top line F sharp or E concert. Making sure to hold the assembled mouthpiece and barrel at the proper playing angle. So I tell them not like a kazoo, but approximately a 45-degree angle. We'll get in more detail with that in a little bit. Keep the embouchure description as simple as possible. Students are already overwhelmed with talking about how to assemble the instrument and hold it and how to breathe and read music. Keep things simple. Try to relate the embouchure formation to something young students may already know. So for a pointed flat chin, you can say it's like whistling or applying chapstick or lipstick to the bottom lip. The lower lip needs to have just enough over to form a cushion for the teeth. Some of the red part of the lip should always be seen. So I tell students not to have Hoover lips where everything is sucked in. The amount will vary according to the thickness of the individual student's lips. The upper teeth should rest on top of the mouthpiece. Check for the proper amount depending upon the mouthpiece, the facing, and the student's embouchure. The corners of the lips should be closed around the mouthpiece to form an airtight seal, and you want them to think in and down rather than up like a smile. Right? The cheek should stay snugly against the teeth so that we don't have puffed lips. We want to make sure that all the air is going into the clarinet. For the amount of reed in the mouth, have students mark the reed lightly with a pencil where the reed and the mouthpiece meet. The lower lip is going to be placed at that point. Most students take in too little mouthpiece, which closes off the reed and the sound. The most pressure should come from the top lip. This helps to prevent clenched jaws and closing off the reed. Have them practice embouchure formation without inserting the mouthpiece, so they can take their finger and place it in the curvature of the chin to accentuate that flat chin before they try to form it with the mouthpiece. For their first attempts at blowing using the mouthpiece and barrel alone, they want to first form the embouchure correctly before inserting the mouthpiece. Be sure that the lower lip is not pushed over the bottom teeth when the mouthpiece is inserted. Right? So form first, then place. No attempt at blowing through the instrument should be made until the student can maintain correct embouchure with the mouthpiece and barrel. Have the students practice taking the mouthpiece in and out of the embouchure without disturbing the correct formation. With the mouthpiece in place and the embouchure correctly formed, have the students blow fast air stream into the mouthpiece. Don't mention the tongue yet. Suggest that students say he into the mouthpiece. Correctly formed embouchure and airspeed will produce again that F sharp or the concert E natural.
Well, that sounds simple. We make it hard, right? We do. So my approach to teaching embouchure is very similar to the concept that Denise just talked about. And I'll just take her very clear step-by-step procedure and expand upon it a little bit with some further thoughts. So the foundation of the embouchure is based on that fixed, stable opening of the jaw, cushioned bottom and top lips, and the engagement of various muscles of the face. I basically pictured this entire triangle of my face as the embouchure. Okay. So the first step that I talk about is the open jaw. Okay, we're not even talking about the lips right now. We're talking about way back here. And perhaps if you think ooh or oh, you can you can feel how that jaw slightly opens, which starts to actually engage the embouchure muscles and actually can help start pointing the chin. Next, in forming the embouchure, spread the lower, I like to say, spread the lower lip across the front of the lower teeth rather than over the bottom teeth, because so often, and I'm going to get closer, that's what you see students do. And then you get the little crinkle chin because they just can't point the chin there because they have way too much lower lip over the bottom teeth. So by basically saying spread the lower lip across, that gives just enough lower lip over those bottom teeth to cushion the read. And again, that also helps to engage the chin by pointing. Okay, then the upper lip and the side of the mouth muscles go down and forward. And the tongue is pulled back slightly and raised in the he or hue position, where the back sides of the tongue are lightly grazing the upper back molars. And the middle to the tip of the tongue, those muscles are engaged and suspended in the middle of the mouth, not resting in a low position in the basement of your mouth, basically. Okay, we want everything to be high in the back and just suspended in the middle, poised. Then you insert the mouthpiece wedge into this set embouchure. And notice that I advocate setting the embouchure before the mouthpiece is in the mouth, okay? So many students will just oh, right? Because they're so excited and they put the instrument in their mouth and then they form the embouchure. If you can think of actually having everything set and then introducing the embouchure, introducing the mouthpiece reed wedge, that works splendidly. Producing the sound. Once the basic foundation is set, the top teeth gently touch the top of the mouthpiece, and as that cushioned bottom lip and engaged upper lip muscles press down to accept that mouthpiece wedge into its fixed, stable opening, making sure that the jaw remains open and unchanged, you take a breath through the opening of the sides of the mouth, maintaining contact points on the mouthpiece reed wedge. And what I mean, and then with the relaxed throat position, you accept the air into the mouth. Okay, so what I mean by keeping contact is once you insert that mouthpiece reed wedge, sorry, I'm talking with my mouth full. Once you insert that mouthpiece reed wedge, you're going to notice when I breathe, you're going to see the sides open, but I will not move my upper lip or my lower lip. Okay, you see a lot of students do this. Or I see that sometimes too. You see them actually open the lower, remove the entire lower lip off of the reed. Neither one of those do you want because that changes that jaw opening and we're trying to keep that fixed, stable jaw. So again, once you do all of that, you have the mouthpiece, reed wedge inserted, you're remaining contact and you're opening up to breathe. Once, after you inhale that air, as the corners of the mouth cushion forward to form that rubber band seal around the mouthpiece, then you raise the tongue into that he position to create that proper air funnel inside the mouth to allow for that fast, cool air speed, and then you begin blowing air into the mouthpiece. Okay, and note that the air that you breathe in is immediately expelled out slowly without being stopped by the tongue on the reed or holding the air in the lungs and then expelling. And we're going to discuss this later in a future video. And as the airspeed increases as we exhale to the point at which it actually causes that reed to vibrate enough to make a sound, that's when I tell my students to introduce this tongue stroke, D. okay, where the top tip of the tongue touches right below the top of the reed. And again, we're going to discuss this he-D concept of creating that initial sound more in depth in a future video. And most definitely, as Denise discussed in her embouchure procedure, you can eliminate the tongue entirely when first introducing the embouchure and having a student create the initial sound. Okay, so here's without tongue, and then here's with. Okay, either way will work. So those are our basic concepts about the ever important fundamental of clarinet playing, the embouchure.
Yay! And in part 2 of this embouchure series, we're going to further talk about some ways that you can practice the clarinet embouchure and talk about how the tongue placement within the mouth affects tone production and the voicing, overall voicing of the clarinet.
So in the meantime, make sure to visit our Amaketia Duo website at theamaketiaduo.com and follow us on Facebook and Instagram.
And if you wish to contact us about a future video subject that you'd like for us to address, or you wanted to have maybe a virtual masterclass with us via Zoom, please email us at theamaketiaduo@gmail.com. Play pretty.
Play pretty.